There is a huge health issue going on in this country, and it's getting worse. It is a crisis of bone health. It's osteoporosis. And more people are experiencing osteopenia, osteoporosis, having difficulty with bone health. It is not just women who struggle with this. It can be men also, and it can hit across any sector of the age spectrum. Many people, when they're diagnosed with this, think that they have no option but to follow the conventional recommendations, and they don't realize that there are some really wonderful holistic and nutritional recommendations that can be used in order to help support a good, healthy bone structure in your body. And that's why today I am so delighted to be talking with my very good friend and dear colleague, Margie Bissinger. Margie is a physical therapist. She's an integrative health coach. She's an author. She's also a happiness trainer, which is wonderful. And she has over 25 years of experience in helping people with osteoporosis and osteopenia improve their bone health through integrative and comprehensive methods. She has created a program called Happy Bones, Happy Life, and Happy Bones, Happy Life podcast. And there's going to be an upcoming summit, Natural Approaches to Osteoporosis and Bone Health, where Margie is going to share her brilliance, as well as bringing many other guest speakers on to help people know how to protect and support their bones. Margie, thank you so much for being here.
Oh, Mira, I love being with you, and I'm so happy to just join you and help spread the message.
So you're doing this summit, and this is actually your second season for the summit. So, the first one was so well received, and it's great. This is such an important thing. And I think people don't really understand, like they hear, okay, osteoporosis, maybe thinning of the bones, but what specifically is osteoporosis?
Well, the word itself, osteoporosis, means porous bones. But what happens is it's actually a change in the microarchitecture of the bones. So where there should be nice cross links in the bone itself, so it's nice and strong, can hold you up, and the quality of the bone matrix, that's gone. So instead of being nice and strong, now you've lost those cross links, and the bone becomes weaker, more porous, and more likely to fracture. So that's the problem. But there's two parts to it. It's density and quality as well.
Okay. And so when it comes to the density and the quality of the bones, what's the best way to find out what your bone structure is like?
It's so interesting because how it's defined, how the definition that someone finds out they have osteoporosis is really based on the DEXA test and the bone density test. And basically they look at your bones and they compare that to a 30-year-old strong, healthy bones. And they look at how many standard deviations are away from that. And so if it's 0 to -1, that's considered pretty normal. -1 to -2.5 is osteopenia. And then -2.5 and lower is osteoporosis. So it's a bit of a random thing, solely based on the density, not looking at the quality whatsoever. So two bones that have the exact same bone density, one can have good quality, and then if the person falls, they won't fracture, or another one will shatter. So the quality, they do have something called TBS, which is trabecular bone scoring. And some of the DEXA scans now have that software where they can also look at the quality. So that does give you a lot more information. But right now, that's the gold standard, how they evaluate. But there's other testing I personally think is important because it just gives you a snapshot. So if it's your first bone density, you don't know, maybe as a child, because we develop, the majority of our peak bone before we're 18 in women and 20 in men. Those years are so important. So there might be people who just didn't eat well, didn't exercise, or who had issues early on and didn't develop the same bone versus someone who's actively losing bone. I like what's called bone markers, where they can actually see, are you losing bone? And just to get more information. But typically people will be diagnosed on just the bone density test.
And so when should they have a bone density test, and how often should they do it?
That's an interesting question, because I think right now the American College of Obstetricians and Gynecologists, they recommend at 65. Well, at 65, usually with women in menopause, after menopause starts, that's when you can have more accelerated bone loss due to the reduced amount of estrogen. And so 65 to me, that's way too late. And there's different philosophies on it. I think anyone at risk factor, if you had issues with digestion, Crohn's disease, if you've been on any type of steroids, so if you have any risk factors, I would say, 30s when you have your peak bone, just check it out early on and see if there's any, get a baseline. For other people, I would say, perimenopause or right after menopause, just see where you're at so you can know for, down the road. And it depends, insurance usually doesn't cover it more than every 2 years. So depending upon what other testing you're doing, sometimes people want to see it every year. Otherwise, it's every 2 years. But these bone markers can be done every 3 months. So it can give you a better idea, is a certain treatment working as well?
Wow, that's really interesting. Now, I know everybody thinks about calcium for bone health. And so if we think that we're trying to protect our bone, or if we have some bone issues that we're trying to hopefully correct with nutrition or at least support, what are some of the other nutritional supports that we really should keep in mind when it comes to bone health?
That's such a good point, Mira, because what I see is people are getting too much calcium because everyone talks about calcium. So they're getting some in their diet. And then the doctor will say, oh, go on 1,200 milligrams of calcium, or they'll tell them take calcium. And what's recommended in this country, different in other countries, is 1,200 milligrams for anybody, women over 50 and men over 70. But that's total. So that's food plus supplement. And so when people then supplement beyond their diet, they're oftentimes getting way too much. And this is a situation where more is not better because we need that calcium to go into the bone. And there's actually been some studies, nothing 100% conclusive, but with kidney stones, with more cardiovascular issues because of excessive calcium supplementation. So even the American Bone Health and Osteoporosis Foundation, they're like, get it from food first. And only if you're not getting enough from food do you want at that point to supplement. So calcium is important, yes. Vitamin D is very important. And what I think there is everybody should get their vitamin D level tested. And most doctors do. And most people will see their vitamin that's called 25 hydroxy. So if you're on par, if you're getting enough, if you're absorbing it, what's going on. The other one that's missing so much, and that to me is absolutely essential, is vitamin K2. Because K2 takes that calcium and it gets it into the bones and actually sweeps it out of the soft tissue. So it's not going to go to your arteries. It's not going to go to your joints. It's not going to go places that you don't want it. So I think K2 is very, very important. There's 2 types. There's an MK4, MK7. There's different philosophies. Both are very good. And, there's been more research on the fracture prevention aspect of MK4, but it has a much shorter half-life. So you need a much higher dose of 45 milligrams when they did the study, which is quite high, so you have to take 15 3 times a day. Or a lot of the people I've interviewed say they do it twice a day because it's just too much. People won't do it 3 times a day. Or there's MK7, and that's usually at least 180 micrograms to possibly 360 a day. And that has a very long half-life, like a couple days. So that stays in your system. So the research is still out. They're both good. And if you can eat natto, that's a food that's sort of slimy, but the Japanese have had tremendous protection from eating that, which is very high in vitamin K2. So K2 is huge. That's one of the ones that the doctors usually don't tell you about it, but it's so important. And then magnesium is absolutely essential in terms of also just being a support for calcium absorption and has so many other factors in the body. So I'd say magnesium. And then there's a whole host of others. Those are the main ones. Of course, zinc's good, and biotin and manganese. There's all sorts of other ones that are important. But I think in terms of the vitamins and the other things, protein. It's a big issue as people get older. They're finding they're not getting enough protein. And protein is something that sometimes it got a little bit of a bad rap a while ago. Like people are getting too much protein. They're losing calcium in the urine. But they found in all the research that protein is very, very important. So yeah, eat the rainbow, but make sure you get those key nutrients. And I like you, Mira, I like doing testing also to see what people are missing. Because sometimes why test, don't guess to see if there's anything missing.
Yeah. And I think it's so important because it's not like we can just, slap a sticker on our forehead. It says you're low in whatever. Like you really need to do a blood test to see that. And I love that your approach is food first And then to see what you need beyond that, supplement, but appropriately, because overwhelming your system with too much isn't good. First of all, it creates expensive. The other thing is there can be some side effects from over supplementing. So the goal is not just to race for that.
And one more thing I wanted to mention is that bone matrix, that is, if you fall, you won't fracture. That's important. And that's protein. Also, vitamin C is very helpful to help that good collagen matrix. And even collagen is good, but that, vitamin C and protein are what help build that nice, strong, flexible matrix. So if you fall, you won't fracture too.
So speaking of strong and working on bones, I know it's really challenging sometimes to know what kinds of exercises are the best things to do for bone health, because you hear so many different things. One expert will say, do this. Somebody else will say, oh, no, don't do that. Do this. Like, how do we know what's the best things that we can do to keep ourselves active, strong, and protect our bones?
And the good thing is the research is very supportive of this. And there's been research on what actually improves bone density. So a lot of people will say, oh, just walk. Yes, walking's good. And they've shown that walking, it's weight bearing. But the problem with that is that it doesn't give enough force if you're really trying to build bone. So walking will help reduce hip fractures. It helps your balance. But there's two things. There's resistance training, strength training. So when the muscle contracts against a resistance, so let's say we're contracted, it's saying, hey, we need more bone here. It's that pulling of the muscle. That's the stimulus for more bone to be produced. So strength training is key. And with strength training, the main areas that are most likely to fracture are the spine, hip, and the wrist. I mean, I believe in strength training the whole body, but oftentimes people will do things for the hip or they'll do things for the arms. They don't do a lot with the spine. So things like, working on weights, working on your back muscles are so important. And so all types of things.
I just unconsciously sat up a little straighter.
Yeah. So strength training, and you need to do it at least twice a week, not on consecutive days, because that's what they found in the research. But it's not a matter of doing 50 repetitions. It's the resistance that's the stimulus for more bone. So, between 8 to 12, I like between 8 to 10 repetitions. And then it feels somewhat hard. You gradually move up to this in good form. Very important to do it with really good posture and good form. But so strength training is key. And, even things like squats and lunges, that you're using your body weight. And you can also do, there's all sorts of exercises, but strength training is very important. And they've shown increase in bone density with strengthening at all ages. So my suggestion for this, though, is that physical therapy, at least in the United States, is covered for people with osteoporosis. So I think the very best thing is get an evaluation. You can go in, see a physical therapist, because one size does not fit all with exercise. And if you have an issue with your shoulder or your leg, they'll work with you as well. And you can figure out what's best for you, making sure your form is good. You want to find a physical therapist who's had experience in osteoporosis. And so that's one suggestion. So strength training, also impact exercise. So that's when the weight's going through the bones against gravity. So for younger people who don't have any issues, jumping, anything where we're getting the weight through the bones, and depending where you are, even just going up on your toes and down on your heels in good form, in good alignment. And one of the handouts that I created for the summit, Mira, I showed 2 exercises that are one where you are going up on your toes and down on your heels in a really good posture that's getting forces all day through your bones against gravity. So those are the 2 things that have been shown, the impact as well as the resistance. But it's important because there's one exercise called the Lift More study that was done in Australia that really showed significant improvements. But if you look at the pictures, someone could say, oh, well, I'll just do those exercises. But they were like lifting themselves up in a bar and jumping down, and dropping down. It was supervised. So I think it's very important not to just go through the magazine or see what's worked in the research and do it yourself. I strongly recommend working with someone who knows what they're doing. So I would say definitely strength training, impact, weight bearing, and then also balance, no matter where you're at. People fracture because they fall. So, you can really prevent fall prevention. So all sorts of different balance exercises. And I think I recorded like 5 or 6 of them on this sheet that comes with the summit, but also Qigong. I love Tai Chi and Qigong. It's like a great way to improve your balance and really prevent fall. So balance and posture and an exercise program is going to make such a difference in keeping your bones strong and healthy and even improving the situation, because couch potatoes are very high risk for bone loss. So so it's a win-win situation when you add the exercise. And you're right, there's not a lot of guidance. And why don't we just mention what's contraindicated?
Okay, that would actually be great, because I think it's helpful. We're talking about these things that you can do to nourish your bones or to strengthen them, but it'd be really good not only to know what you shouldn't be doing, but also for people to be aware of what are some of the root causes. Why do we need to be concerned about this? So if we could talk about both those things, that would be great.
Yeah. So we talked about the strength training and the impact, but what they've shown, there was a study done, it was done a while ago at the Mayo Clinic, and they looked at different exercises in terms of fractures, because at the end of the day, what's going to impact our life is not if our DEXA is minus 2.5, what's going to impact if we have a fracture. So we want to do everything we possibly can not to have a fracture and to, fracture proof our bones. So in terms of exercise, they did a study looking at people doing different exercises and what the rate of fracture was over a 6-year period of time for people who had osteoporosis. And they found that when people did extension, backward strengthening, they had a 16% fracture rate. People who did forward bending, rounding, did only rounding, 89% fracture rate.
Oh my gosh.
Because it's at the front of the vertebrae, where it's the front that ends up, instead of being nice and square shape, it's wedge shaped. So you're getting all the pressure when you bend forward on the front of the vertebrae, which is more in the thoracic spine, which is more, that's the area that's most likely to fracture anyway. So this made sense. So what we don't want to do, touching your toes, doing the windmill, no, not that you can't bend forward, but instead of bending from the waist, we bend from the hips and knees, maintaining that nice inward curve in our low back. So yes, I put all sorts of information even before you get the summit. If you just sign up, you'll get these handouts. That's
the link down below so that people can have access to that.
Just because you need to, the posture is such a big point part. You'll see people sitting all day rounded. Well, they're putting extra force on their spine, really increasing their risk of fracture. So yes, so we don't want to do any rounding. We don't want to do extremes of motion. If you have osteoporosis, I said osteopenia too, and even disc problems. When you do that forward bending, touching the toes, it puts a lot of force on your discs. But extremes of motion too. So extreme rotation, you don't want to go maybe 80%. Same thing with side bending, because if you have a weakened spine, you don't want to put extra force. The main thing is that forward bending. People don't realize that can be putting them at risk for. And so there's so many yoga instructors and so many people who are like, what? And I'd had to send them articles. So yes, you can modify all of the yoga. And I love yoga. I love Pilates. And you can modify all the positions so that you're not, just doing rounded postures.
Yeah, no, that's definitely so good to know. And then what about root causes? Like, what are some of the things that are at the basis of increasing someone's risk for developing osteopenia, osteoporosis, and what are the things that we need to be aware of? Because I love that you talk about the fact that, and I'm just going to share that I have not had a DEXA scan yet because I haven't hit 65. And so now I'm thinking in my next physical, I need to say to the doctor,
you get over there, Mira. Yes.
I love that you're talking about like start at 30, because we need to protect our bones. This is our internal architecture for the rest of our lives. And so I
don't think everybody needs to start at 30. I would say, premenopause or menopause, that's where I would say for sure, unless you really have risk factors that you suspect something early on. But, eating disorders, and unfortunately, so many kids now and so many people have all sorts of digestive issues, and digestive issues play a huge role because we're not absorbing our nutrients properly. So anything where it's going to block absorption of the nutrients, any type of digestive issues, anything that causes inflammation. And there's so many, so many food issues. There are people with gluten, with dairy issues that's causing inflammation that can be affecting their bones, or just, rheumatoid arthritis. When there's an inflammatory condition, an autoimmune condition, it's going to put you more at risk, because when your body's inflamed, it affects the osteoclasts, which are the cells that actually, destroy. There's bone building, and then there's cells that actually sort of break down bone. And so it actually increases the breaking down of bone. So any type of inflammation, when people are on steroids, certain medications, a lot of people who have stomach issues are on PPIs, the proton pump inhibitors, that reduces stomach acid. And we need that stomach acid to break down our proteins, break down our nutrients. So it's going to affect our bones as well. And, it's a big reason that people have. So there are medications, even some of the antidepressants will affect your bones. So medications. And then, and you sort of need to figure out, I've seen so many times where, people are literally just unfortunately, conventional treatment, and I don't fault them because this is what they're taught. The DEXA shows a minus 2.5 or lower, and they're like, okay, you have to go on medication, not taking into the account, well, what could be going on? And I think they're missing the boat. If someone has a major digestive disorder and they're not dealing with it, you're just putting a Band-Aid on it. You're not going to, so I think when you delve in, figure out dysbiosis of the gut, if there's a problem in bacteria, there's so many things can affect the bones. So you need to deal with the root causes. And then you can, if the inflammation continues, it's going to be counterproductive.
And, I think that's so important to keep in mind, that we are whole body beings. So we need to look at all those factors and take a lot of different things into account. Don't just pin it on one answer, but to look what else is going on. And I know also, because you and I have talked before about the happiness work that you do. So I'm just curious, I'm assuming state of mind has something to do with it as well.
It has a very big part to do with it. They've done research that the stress hormone cortisol actually reduces the bone building, the activity of the bone building cells. And I see this so often. People really care. Are they eating the right foods? Are they exercising? But they don't realize that how they handle the stress in their lives plays a huge, huge component. So it's a very big part of everything I do in all programs, because that's going to be currently eating away at your bones as well. So they've done research on stress and increased bone density when people, there's a correlation between cortisol, the stress hormone, and bone density, but also happiness. They found that people who are happy and content with their life as well have increased bone density, and sort of makes sense. So I found in the work I do, I learned that very early on in my career when I was dealing with chronic pain patients, that, I'd gone through sort of a bad situation, and they're like, you're so happy. I'm like, I'm so happy. But then it hit me that, I sort of was, even that my situation wasn't happy, that it wasn't based on your external circumstances. It was an internal job. And when I started teaching things that helped me to my patients, it was shocking that chronic pain got better. It was really that I've been doing that for, over 35 years. And I found, though, also that when people start adopting these happiness habits and they're happier, their stress is reduced, first of all. As I said, the research shows that improved bone density, but they also are more willing and happier to engage in good eating and all the things you teach, Mira, as well as, a good exercise program. Just life becomes sort of more miraculous. So to me, it's one of the foundational things of health. And I found when you do that, a lot of times people think it's selfish. Oh, come on, working on your own happiness. But it's just the opposite, because when you're happier, everybody around you's happier. So now your whole family and people you interact with are happier, and then they pass that on. And the world right now can use as much happiness as possible. So it's the least selfish thing that really you can do.
Well, that sounds wonderful. I think we're going to have you back on and just talk about happiness, because I'm sure that's like a whole big topic in and of itself. I love everything you've shared. You so much wonderful information about nutritional things, what to do, what not to do, how to support ourselves. I think this is all really wonderful. And I know you have a summit coming up. Can you tell us how people can connect with you and connect with the summit?
Yes, I'm so excited. And Mira, your talk is fantastic on the summit. Mira talks about how to make it possible, how you can because it may not be easy. You're thinking of how am I going to cook? How am I going to get these bone healthy nutrients? And you put it in good steps. You give some great tips. I really am excited for everybody to hear your talk. But so I did a summit last year on, it's called Natural Approaches to Osteoporosis and Bone Health. And it was unbelievable what happened. And I had all the things that I thought were important. I had phenomenal physical therapists who work with this. I had practitioners who work with this on a daily basis. And so many people changed their lives. It was just, I can't even tell you how many people were able or figure out, there was a parathyroid surgeon who's back again. And people didn't realize what their numbers were. And 20 people found out they had a parathyroid tumor that needed to be removed. Had they not removed it, they would keep losing bone. So anyway, so this year, I didn't want to have just the same thing. So I have, other than one talk, because I didn't want to change it because it was all about exercise and there was so much information. But other than that one talk, all new talks. So 53 new talks. And really on all root causes, what you should be eating, what testing to be done, and exercise. And I believe that you need to see it. So I have people showing exercise, showing dances that are good. I have a Qigong person teaching a whole routine. Let's see what else. And then I have a Feldenkrais practitioner teaching how to have better posture, what you can do, and how to increase your pelvic floor while you're doing it. So there's just tremendous amount of information. And I'm just so excited to share it because I really believe the good news about this, Mira, is that so much can be done, and it's almost like people look back and, you may not even you feel fine, some people, because it's silent. But yet when you find this diagnosis, it opens you up to sort of evaluating your life. And when you do, you can make changes that will positively impact the rest of your life. So you look back and think, you know what? Hey, I'm on this great exercise program now. I'm doing all these things. And this was really the catalyst. It was a blessing in disguise, because now you're doing all sorts of good things. So lots of things, lots of practical things you can put into your life. And I'm just really, you can see I'm very excited about sharing it again, because when you can change so many lives, last year around 60,000 people came, and when that many people can be impacted and learn something, even if they learn a little something, it's still a move in the right direction. And so, yeah, so that's that. And otherwise, my website is just margiebissinger.com. And I have a podcast just called Happy Bones, Happy Life podcast that Mira's been on. And I should tell them last year, Mira's talk was rated one of the best talks on bone bandits. It was really fantastic on bone bandits. And so, yes, so there's lots of good info. And this year, what you talk about is so important.
Well,
So,
I'll be
yeah.
sure to put all the links down below so that everybody can connect with you, because I love your podcast. You do such a great job with that. The summit last year was amazing. I'm sure this year is going to be even better. And then, of course, on your website, you just share so much wonderful information with people. And I appreciate your wisdom and your caring heart, how much you put out there for people to be able to have access to and to learn, so that they can take care of themselves on so many different levels.
Oh, well, thank you so much. And I always appreciate, for everybody listening, Mira is my go-to. When I have a question about a supplement or something, I immediately text Mira, what do you think of this? So I have to always thank you, because you're always so willing and so helpful. And the knowledge that you share is just so powerful. So thank you for having me on your program today. And
Absolutely. And folks, thanks for joining us today. As I've mentioned, the links will be down below. I highly encourage you to connect with Margie, and I really encourage you to check out the summits, both of them, because you can get the past summit as well if you need that information. So much wonderful information there. And while you're checking out the links below, please be sure to click that subscribe button so we can stay connected and you can know when I have more amazing guests like Margie on. Thanks so much for being here, Margie. And folks, thanks for listening. Have a happy, healthy day.